Hello, my name is Tracey Turton. I'm a clinical reflexologist here at Cheshire Natural Health. I qualified to practice reflexology in 1995 after the birth of my son, and I gave up my previous job to sort of practice reflexology full time. I find that it's an amazing therapy. It works on an awful lot of health conditions. It's a therapy where we work on points on the feet, and these points correspond to different parts of the body. So as I'm actually working on these points, we're actually having a direct effect on the various parts of the body. It's based very closely on the principles of acupuncture, in that the body, we believe, is a dynamic energy field, and any disruption to the flow of energy within this field can cause ill health. And with treatments such as reflexology and acupuncture, our aim is to make sure that the energy flows freely through these energy fields, through the meridians, and that allows your body to actually function better. So for example, if people have headaches, we would work on the big toe. If people have back problems, we would work on the instep area. The main benefits of reflexology are the relaxation effects. Anything that's stress related responds really well to reflexology, and other problems such as hormone imbalances, such as menstrual problems, fertility problems, menopausal problems also respond particularly well. So as we're actually working people's feet, a lot of people say that it's the most relaxing thing they've ever had in their lives, and during the treatment they'll feel good, after the treatment they'll feel good, and hopefully the sense of well-being will stay with them for quite a long time afterwards. Today I'm doing a treatment on Anne, who came to me a few months ago for menopausal problems such as hot flushes, poor sleeping and lack of energy. Okay, could you just put your feet down for me, Anne, please? When we're actually working to people's feet, we use a combination of different sort of types of technique. Some of the techniques we call just relaxers, so it's about sort of making sure that everything's relaxed in the feet. It's definitely not a foot massage. We use pressure on very precise parts of the feet, especially where we actually need to be working. So if we can, we work the whole of the foot, and then we'll concentrate on specific areas as well. So at the moment what I'm doing is just trying to relax Anne's feet, just using different things. We use cream mainly, we can use oil, but usually we use cream as well. Just take a deep breath for me, Anne. So what I actually feel when I'm doing a treatment are almost like little bits of crystals underneath the skin, and that tells me where there's an imbalance in the body. So as we actually work on those areas, they either improve sort of within the treatment, or certainly over a course of a few treatments they would improve. And what the patient would actually feel is some sensitivity at certain areas, and again that corresponds to an imbalance in the body. I say to people, it doesn't necessarily mean that there's a problem in the body, but there's just an energy imbalance, and we can actually work on that. So the feet almost help us to diagnose what the problems are. Basically, this area here is the chest area, and then the area in the centre of the foot are all the internal organs, and then around the heel we've got the colon, all the pelvic areas, and on the inside instep here it's all these spines, so starting off from the head right down to the lower back. And then on the outer edge we've got the arms and the legs as well. When we start off with the treatment, we usually start off by working the toes. There's quite a lot of important reflex points on the toes. The toes represent the head, so the neck area is here, and for a lot of people this can be very gritty, and a lot of people do carry a lot of tension in the neck. And then as we go towards the tips of the toes, that represents the forehead, the sinuses, and also up towards the brain as well. And Anne here has got quite a lot of grittiness around the toes, and it's hay fever just starting at the moment, Anne, isn't it?
It is,
so
yes.
That can be a little bit gritty. So we just basically use a little bit of pressure on each of the toes, and sometimes it feels tender, sometimes it doesn't. Okay. And then on the ball of the foot here, these represent the lung area, lung and chest areas, and as we come sort of on the middle of the foot here, all the internal organs across here, so the liver, the kidneys, the pancreas as well. And then on the heels of the foot represent the colon, so the large and small intestines on the heels of the foot. And then outside of the foot we have the shoulder, coming down the arms, and also the legs as well. And on the inside of the foot we have the spine, so starting off from the head, the upper spine, working right down to the lower back as well. So we would tend to just use a technique all the way down the spine, and you can very often find sore spots as well which correspond quite accurately to where people have spinal problems. Just working here, that's the shoulder reflex. That actually feels a little bit tender today as well.
It's not too bad, no.
They're not too bad. Okay, just working across your shoulders there. That feels quite nice. This is the chest area here. So have you just started with the hay fever at the moment?
Yes, just last week.
Okay. Okay, this is just, again, working on the chest and the shoulders on the other foot as well. And this is the adrenal reflex. This shows quite a lot when people feel stressed. That feels a lot better than it did when you first came.
It was very painful.
It used to be quite tender. Yeah. That feel okay today?
Yes.
Okay, very good. This is, we're just working on the big toe, and the big toe is called the pituitary gland, and the pituitary gland balances the other hormonal glands as well. How does that feel, Anne?
That's fine.
Okay, that used to be a little bit sore when you first came, didn't it? It feels
was.
okay at the moment. Okay, just working to that. Another area that's quite important for hormone balance is the thyroid as well. That feels good today, actually.
It is.
Feeling all
much
right?
better.
Okay, very good.
I was referred here by the nurse at our local GP's surgery for menopausal problems. I was having problems sleeping, hot flushes and tension. And after the first session I could feel more relaxed, but after 3 or 4 there was a definite improvement in the sleeping condition and in the hot flushes as well. I've continued coming in monthly so that the benefits continue, and also the main part I find is it's totally relaxing.